Ready, set, Oppo.
Ready, set, Oppo.
You see me a little bit of lotion on your elbow.
I told her.
I did! 1 second, guys, 1 second. I'll be back.
This is crazy. Alright, let's have another waffle. Let's do this.
Wait,
no! You won't be able to tell. Trust me. Look at this.
Look at this one. You can't even tell we have a waffle.
Guys. Hi, guys.
Hey.
Oh, okay. So what's going on today?
I cannot.
Hi, guys. How you doing? It's your girl. I probably shouldn't do that.
Yeah, it's very gangster.
Hi, guys.
Let me try that.
Okay, can someone else just start this vlog? Otherwise, we'll be here for a while.
Hey guys, I'm Serena. I'm BC's friend.
And co-worker. I'm Oppo. I also work with BC. We all are OBGYNs at SUNY Downstate here in
Kings
Brooklyn.
County
in
Hospital
Kings County.
here in Brooklyn.
And we decided to kind of meet up today and have brunch and also talk about pre-eclampsia.
This is Pre-eclampsia Awareness Month, and next Saturday will be, actually, it's the day that we're
The 22nd.
dropping
Yeah.
this video.
Yeah.
Right?
Yeah.
Yeah. So the 22nd is Pre-eclampsia Awareness Day. So we thought this would be a great opportunity to talk about pre-eclampsia. This is my son, Afra.
And I'm busy. I am the CEO owner. Not owner. I'm doing this.
CEO owner.
I'm busy and I'm the face behind lipstick and stethoscope.
We're very excited to support you on this.
Oh, thanks guys. Okay, all right. So I'm gonna just introduce what we have, and then we're gonna get going into things. All right. So we have waffles, chicken and waffles from Sweet Cheek. Nothing really fancy.
A Brooklyn institution.
Oh yeah.
It's a New York institution.
This is not an ad.
No. Yeah. No.
Unless you guys want to pay us.
Yeah, unless this is a sponsorship situation, in which case we're in.
All right. So we have chicken and waffles. We have that, and then we have this as well.
Waffle
and we have
fries, I think.
yeah.
And that, you have to tell them.
Sorry.
They're going to be able to just know.
Lord,
And when we had this divine chocolate chip waffles, were so good.
This is some kind of
I think it's a large waffle fry.
Waffle fry?
Yeah, one way to find out.
Yeah.
Go for it. It's good.
So crunchy.
Definitely a waffle fry.
And that
Very
sauce.
crunchy.
That sauce.
Also, I'm a very loud eater, so it's not going to know.
Guys, no smacking, okay? No smacking. We're not doing that. No smacking.
That's
No, like
lip smacking.
Oh, okay.
Girl. All right.
Okay.
So I think we're good to. Should we eat first and then just like
Let's just
go into it? All right. Okay. So we have a bunch of questions that we're gonna touch on today. Wow, guys. Wow. Can I try?
No,
Wait.
we're gonna touch on a lot of topics today.
Yeah.
You know, between the
Oh, this is
smacking.
good.
It's really
I know,
good.
it's really good.
Oh, this is good.
Yeah.
It's busting.
We really kind of just want to go over preeclampsia and talk about some of the things that you can expect and just raise some awareness for what it is and what we should be concerned about.
Exactly. All right. So just gonna jump right straight into it. Okay. So
Yeah.
can you?
Particularly our population working in Brooklyn, we have a lot of patients that come in and are usually high risk. We see preeclampsia every day. I think actually last time I was on call, I look at everyone and I'm like, guys,
Everyone's
there's
preeclampsia.
a lot of preeclampsia today.
Oh.
And I'm like, what?
Yeah, I think it's like half the time I feel like.
Yeah.
There's always a preeclampsia. Mm-hmm.
I think the craziest one I've seen is when I was on call. Sorry, on rotation with you at King's, and we had that lady with like the severe blood pressure and like she had like the almost
Vision changes,
Yeah.
almost had.
that's like the worst
Yeah,
case of
yeah.
preeclampsia that I've ever seen. So
Yeah, and preeclampsia and eclampsia can kill some of our patients.
Yeah.
And we've actually unfortunately seen that. So it's something for us to be really, really thoughtful about and make sure that we get as many people as we know to be aware of it during pregnancy and even after pregnancy.
Yeah. And it's crazy because I think what's really mind-blowing is how even lots of pregnant patients don't even know what preeclampsia is.
yeah.
And so that's really why it's really important for us to have this video and kind of reach out and try and educate people.
Yes. So I think the main thing is what is preeclampsia. Yeah. So guys, what is preeclampsia?
How would you describe preeclampsia to your patients?
So my patient, I'll tell them preeclampsia is pretty much high blood pressure in pregnancy. It's pregnancy-induced high blood pressure. We typically diagnose preeclampsia after like 20 weeks. If it's before, it's normally not called preeclampsia, but after 20 weeks, we call it preeclampsia.
So if you have high blood pressure in your pregnancy and it's before 20 weeks, that's usually a sign that you actually have some kind of underlying chronic hypertension.
Yes.
Sometimes the things that because patients come in and your first time visiting the doctor is during pregnancy, we a lot of times will diagnose things that people have had the whole time. And we'll diagnose it during pregnancy, but early enough in pregnancy where it's not really due to the pregnancy, if that makes sense. Right. So diabetes and high blood pressure before 20 weeks means that most likely you had it before.
I guess like in terms of the idea of the blood pressure cutoff, like how would you know sitting at home your blood pressure, the first number, the systolic blood pressure is above 140, or the diastolic, the second number is above 90, that's kind of hard, right? So typically for us, we have so many patients who have preeclampsia, so almost all our patients are at home with blood pressure cuffs on, and I think like that makes it easier for them to kind of monitor their blood pressure. So then it comes down to who do you label as somebody who's at risk, right? Like, who are high-risk patients, who are patients who we think have a risk factor for preeclampsia.
And therefore should maybe be a little bit more with their guard up as far as high blood pressure goes.
Yeah, right.
So those patients tend to be the ones who've never had any children before. If it's your very first pregnancy, then definitely. Then if you are obese, so if your BMI is over 30, which I mean is a large population of ours. And in general,
if you have like underlying, I guess we could divide them into like the patients are like very high risk, moderate risk, and low risk. Yeah. Just so it's like more.
Low risk is if you've had the perfect vaginal delivery the last time, and that's it. Those are the only patients who are low risk. So if it's your first time, you're having twins, you mentioned obesity, socioeconomic factors.
And I think what's also interesting is age, right? Because if you're an 18-year-old, you're at high risk because of that. But it's like also like the other end. Extremes. If you're 35 and above, you're also high risk for preeclampsia. So it's kind of interesting how it really is there's a lot of factors that go into it.
Right. So who would you say is in the severe risk or like the higher risk?
So if you have kidney disease,
if you've had preeclampsia before, you're like. You probably don't get it again.
Yes, exactly. If you have like autoimmune diseases, if you're having twins or more than twins.
More twins,
IVF actually is also
Did you say kidney disease as well? Did you say kidney?
What about if you have chronic hypertension? Are you in that situation placed in the high risk category, medium risk? I would assume high risk.
High risk,
high risk.
Definitely high risk. High risk. If you have high blood pressure, you're high risk. And Lucy talked about the fact that it's at 20 weeks for diagnosis. So I think it's just really important to highlight that sometimes patients don't show up to us until they're 8 weeks pregnant and it was the first time they've seen a doctor in years. Me. That was me. And so, sometimes we diagnose things like high blood pressure and diabetes in that first trimester because it's their first time coming to see a doctor. So when we diagnose it at 20 weeks, before 20 weeks, really what that means is you have chronic hypertension, or if you have diabetes, you have pre-gestational diabetes, or
and all of those things are still sort of precursors, or like I guess it puts you at increased risk for preeclampsia as well. So it is good to kind of catch those things early. So if you're somebody who has been labeled high risk for preeclampsia, typically what we do is we would then tell patients to start taking aspirin, low dose aspirin. So
starting at 12 weeks.
12 weeks, which is when the placenta is just about forming again.
And you can start it as late as 24.
24, 28.
I thought it was 24.
24?
Yeah,
Okay.
we should probably double check.
12 to 28.
28. See? Fabiola, she's got it. 28.
Yeah. So that's something that everyone can do too.
Right.
So just low dose aspirin, and it's 81 milligrams.
That you take every day if you're high risk.
Yeah.
But talk to your doctor before you start it.
Right. But the thinking behind it is, since preeclampsia is considered to be this inflammatory process, that with the aspirin you're helping kind of like abate that a little bit, and that would allow you to, I guess, go further in your pregnancy, because the issue with preeclampsia is that the way to treat it is really to just deliver the baby. So if you want your baby delivered probably closer to term, aspirin has been found to actually do a good job of getting you further in your pregnancy than if you were not on aspirin.
Right. So the reason that it's important to talk about the risk factors is to kind of, it helps us talk about what the underlying issues are that cause preeclampsia. Now, We don't really know the answer to that. I know people always like have this huge debate about whether or not it's the pregnancy, or is it the pregnancy that causes the outcomes in the body, or is it the body that like the body's underlying issues kind of showing up during pregnancy? And we don't really know the answer, but we definitely know it has something to do with the placenta,
right? Yeah. Yep. Like abnormal like placentation or something.
BC, what's the placenta?
Oh, the placenta. Okay, guys, I know that one. The placenta is pretty much what feeds the baby. It's where the baby gets the nutrient from. It's like the exchange. It's what the exchange of. Boy, I'm talking, boy.
He's like, I want that placenta. No, you don't, boo.
It's where the exchange of like maternal and fetal exchange pretty much happens. Baby gets the nutrient from the placenta.
Typically, what we tell our patients is, especially if we're concerned that they may have preeclampsia, is you may be sitting at home and you have a really bad headache, and you may take Tylenol, which is the only thing you can really take for pain like that in pregnancy, and that headache doesn't go away. So if you have this persistent headache, that actually could be a sign. And so one of the unfortunate things about preeclampsia, I think, is the symptoms really are kind of vague, right? Headache, swollen,
vomiting in pregnancy, which everyone has.
Okay, yeah, exactly.
Extra swelling in pregnancy.
Swelling in your legs, not
also
new.
really common.
Right.
It's kind of, I know one of our attendings refers to preeclampsia as the great pretender, and I think that's an excellent way of describing it. It's kind of this thing that is really nebulous and kind of exists, and everyone sort of knows the symptoms and signs, but that's part of the reason why I actually think it's really important for people to know really specifically what preeclampsia is, and also help us as your doctor to help rule it out. Like, you don't have to be the person who knows all the information. You just have to know enough to know you have to come to us. And we'll 100%. Take care of the rest.
So coming in is very easy. All we do is blood work, urine, we check the baby, we make sure your blood pressure is good. And if everything looks good, then you get to go home. But it actually doesn't mean that you're in the clear. Because you may go home and your labs are fine. And I think what's really hard with preeclampsia too sometimes is you feel perfectly fine. Like, sometimes we have patients who have really high blood pressure. Their baby is being monitored on the tracing, and we can see the baby is in distress, and the moms feel perfectly fine. And that can be an issue too, because you're trying to explain to the patient that she has preeclampsia. And for us, it's a very scary thing, which we'll get into why preeclampsia is pretty scary for us.
Yeah, so I think we can actually get into that right now.
Yeah, that's what I was leading into.
So like I guess the progression of preeclampsia. So preeclampsia can go from without severe features. So you just have high blood pressure, or you have like proteinuria, right? But then it could lead to you having severe features. So when we say, oh, hey guys, this patient has preeclampsia with severe features, what we mean is that she has like headaches, or she has what you want. What you want.
The things that you really want to be thinking about with preeclampsia, when we say preeclampsia, instead of just high blood pressure in pregnancy, is because with high blood pressure in pregnancy is if it's starting to affect your kidneys, and your kidneys are starting to what we call leak proteins into your urine, then that's a sign that you have preeclampsia. From there are other things that we look at. We look at your liver numbers, we look at your blood work, we look at your platelet count. We look at a lot of different things to tell us, do you have preeclampsia with what we call severe features, which is now these high blood pressures are starting to affect all of these different organs in your body. And the reason that this is problematic is because your body, during your normal changes in pregnancy, expects you to have low blood pressures. Your body is expecting lower blood pressures, and all of your organs are expecting lower blood pressures. So then when you suddenly have this switch where you have these high blood pressures in pregnancy, it causes all of these kind of things to happen in your body, all of these kind of cascades to occur. And that's when we start worrying about things like something called HELLP syndrome, something called preeclampsia. Sorry, buddy. Preeclampsia with severe features.
And I guess like the whole thing with pre-eclampsia, I guess we didn't really say it, is eclampsia means seizures, right? So pre-eclampsia means you're probably like tiptoeing around, like getting a seizure real soon. So that's why it freaks us out. And so in that time period too, if you're having a seizure, you're not getting enough oxygen, the baby's going to be in distress. There's a lot of issues that can come from that too. So your baby can die. It can escalate very, very quickly. And that's why we care about it so much, and that's why it's really
Right.
important that everyone knows about it.
Right.
We've had patients who come in, they've been seizing at home,
Yep.
the baby, there's no heartbeat on the monitor when they come in and the baby's dead, and now you're trying to get this baby out so you can try and save the mom. It can be pretty disastrous, and
It's
so,
about mom and baby.
yeah,
Right.
for both
Yeah.
mom and baby.
Right.
And because it's a placental issue, it can also affect the baby's growth as well.
Yeah.
So that's also something that we have to kind of watch out for if you're diagnosed with preeclampsia early, or sometimes we'll even notice that patients are having abnormal growth in their pregnancy of the baby.
Right.
And then all of a sudden we are like, oh, they now have high blood pressures, or they have protein in their urine, and you're like, oh, okay, this was just one of the signs.
Right.
So it can kind of be anything.
Yeah. Yeah. It's pretty scary.
Yeah. And it can be less scary when you're in the hospital and we're able to manage it correctly. And so one of the things we also wanted to make sure that people are aware about is what it's like to have preeclampsia and be in the hospital for it.
Yeah, because it totally changes the course of your pregnancy,
Yeah.
I think, and the course of your labor and whatever labor plans you may have as well.
Just from what we do, I believe if you have just preeclampsia, just like the high blood pressure with like protein injury, you get discharged home, right? But
Yeah,
like,
you can go
You
home.
Yeah.
can, not always.
Not
It
always,
depends
yeah.
on how far along you are in your pregnancy.
right,
Right.
true.
And what other risk factors you may have and
Right.
other things that are going on and how the baby's been behaving.
Right.
But another thing too in general is you go from kind of seeing your doctor once every week, once every couple of weeks, to now having to go to the hospital,
Like twice a
having the
week.
baby on the monitor twice a week, make sure your blood pressure is checked. And I think it's all for a good reason, because you may feel perfectly fine one day, have perfect labs one day, and literally the next day it all changes.
Right.
And so that's why it makes sense to kind of be someone that now becomes like closely monitored in the hospital.
And one of the things about preeclampsia is that it's also not just always a spectrum. Sometimes it's a switch. Sometimes you go one day, everything is completely fine, and the next day you're seizing.
Right.
So that can happen.
Yeah.
Which, again, it kind of sounds like we're saying preeclampsia is everything, and it kind of is.
Yes.
Which is why I think it's important for people to do their best to kind of recognize it themselves. Wow, bro. Yeah. Right here. So it is just, it's really important to be aware of.
Yeah. So, is there a threshold where we choose to, I guess, what I'm trying to say is where we keep them in the hospital and then also like treat them with like something called magnesium? Is there a threshold where
Something called
magnesium? You know the vibes.
So preeclampsia, we talked about one of the treatments being delivery, but
Right.
the other thing that we have to do is prevent eclampsia.
Right.
So we give you magnesium through the IV to help minimize the risk of you having seizures.
Yeah, getting magnesium, I always tell patients, I'm like, we're gonna start you on magnesium for, depending, either 24 hours or more, right? Depending on when we start the magnesium. And I tell them, I'm gonna be honest, this is gonna suck for you. It's gonna be terrible. You're gonna be strapped to the bed, because the issue with magnesium is we can't have you moving around.
Yes.
So how it works is it's a muscle relaxant, and basically the blood vessels also have muscles in them, and so basically it works to kind of soften and relax the muscles. And this is kind of part of the way that it helps to either help control blood pressures, but also help prevent with the seizures. But overall, you're a fall risk. So now you're somebody who is bedbound for maybe days. We're drawing your blood every 8 hours or so.
Yeah.
You have a Foley in place. Your birth plan is now kind of out the window sometimes, because if you're getting a lot worse and we need to get this baby delivered, sometimes the best way to do it immediately, if you're not, making changes in your labor, you're not advancing and progressing to fully dilated, is a C-section. And so I think it really becomes a very distressing diagnosis for a lot of people.
Right. And so sometimes just knowing what your options are / knowing what it looks like is just important before you show up, so that you have an idea of what it can look like. So if you're getting, blood draws every 8 hours, that sucks.
It does suck.
hate getting
mentally draining.
Yeah, and having to just lay in the bed. And the magnesium itself can make you feel a little bit off.
Right, yeah.
Right?
Yeah.
It makes you kind of feel tired, lethargic, and that can be a little bit tough as well. But it's kind of what needs to happen to help prevent you from having seizures.
Yeah.
If you're in an area that, for example, doesn't have as high of a level of a NICU, you might have to get transferred to a hospital that has a better NICU. You might have to get transferred from a birth center to a hospital so that you can be monitored continuously.
Right.
So it can really kind of change what you were saying, about it can really change your delivery.
Yeah.
process.
And I think, because a lot of people kind of think of it as 40 weeks, that's my due date, that's when my baby's full term. But your baby's actually full term 3 weeks before that, as far as OBGYNs are concerned. So that means if we think you have preeclampsia, or even honestly gestational hypertension around 37 weeks, because we know that that's going to progress to preeclampsia, for us, you have a perfectly well-cooked baby, time to get this baby, out. And so that's sort of the thinking there. And so that's where I feel like that can be a little distressing to some mothers because they weren't ready for this delivery 3 weeks in advance. Hi guys, so we're back. We lost Serena. Her baby had other plans. So, so it's just us. Get that out of the way.
Oh, oopsies.
Just to kind of wrap things up, we wanted to kind of go over a couple other things that we wanted to talk about.
Yeah.
Like, I guess because we talked about having preeclampsia even after you deliver your baby. So when does this end? Does it ever end, BC?
No. So what we normally do is we schedule our patient to see internal medicine, follow up on their blood pressures. And look, we actually don't even know what happens to them afterwards.
I mean, ideally, we should be, when we send our patients home, telling them to come back 3 or 4 days afterwards, just for blood pressure check. And then even 2 weeks afterwards, we plug them in with a primary care doctor so they have somebody they're seeing to monitor their blood pressure. Because I think it's 25% at least of patients who have preeclampsia end up having chronic hypertension later on. So it's a pretty high percentage, and then you factor in other risk factors now. So there's something called cardiomyopathy, which can happen within the first year after you're having your baby, and that's just because the stress of the pregnancy, the stress of the blood pressure can affect your heart as well. And so usually we have our patients who are very high risk get echo, which is basically where you get a sonogram of your heart to make sure your heart is functioning properly. We plug you in with a cardiologist. Basically, you become just a high-risk patient overall, and you need to stay on top of your health so that we can check to see if you're lucky, maybe 6 weeks afterwards, if you are on blood pressure medicine because of preeclampsia, we may end up stopping the blood pressure medicine if you're lucky. But some people actually go on to just take the medication for the rest of their lives, and that's okay too.
Right.
So it's kind of hard to say when does it end. I think it's just having preeclampsia will just kind of make you realize that you just are somebody that needs to just stay on
constant
health.
Like constant checkup at the doctors.
Yeah, you're someone who should not just disappear and never see your doctor again. Yeah, exactly.
Yeah. Did we heal on everything? I think we did. Did we?
Did we?
I don't know. Abiola, are we missing anything?
You guys are not missing anything. You guys did excellent. I learned so much.
I hope this video was very informative, and you guys are very aware that, preeclampsia is a very serious thing. Please don't take it very lightly. It's very serious. It's extremely serious. It affects your life and your baby's life.
Real serious. But I mean, not to scare you, but I was going to say that if you're someone who is now sort of very, worried about getting pregnant and the risk factors for preeclampsia, what can you do? I think, for one, staying in tip-top shape before you get pregnant, right? Because there's certain things that we can change. So are you someone who smokes cigarettes, uses drugs and alcohol? Obviously try to not do that.
Weight gain during pregnancy. Don't think that, I'm pregnant now, so I'm going to eat everything. Girl,
eat those donuts.
Girl, please no.
Probably not.
No.
Also, just like getting healthier in general. Forming those, healthy lifestyle habits.
Healthy habits,
So if you're going to go out for brunch with your friends and have waffles, great, but make sure you're at least walking for 30 minutes afterwards and, exercising. Moderate exercise to kind of stay healthy.
I see that look here, and I'm going to go to bed after this. So,
But
and then
aspirin. I think aspirin is huge. It's something that anyone can take if you have risk factors. If you have family members with high blood pressure, your mom had preeclampsia, your auntie had preeclampsia, you're a diabetic, you're pre-diabetic. All of these things, honestly, it really doesn't hurt to start taking aspirin after 12 weeks.
Yeah, and if you're not sure of it, just speak to your primary care and be like, hey, I heard about this. Do I qualify? What do you think?
Yeah.
And I would also say getting it's really important to get your own personal blood pressure kit.
Yeah.
Because once you learn to start taking your blood pressure and you know what your normal is, then you know what your abnormal is. So So I would really recommend that. Just go on Amazon. It's like $20. I'll leave a link.
Or your insurance can pay for it. So if you speak to your doctor about it, then that way it can be covered.
Yeah. Some clinics give it for free as well. Especially like the clinics with like high risk patients, they give it for free. Mm-hmm. So check your blood pressure, ladies.
Yeah.
Okay.
Just staying informed is the best thing that you can do.
Stay informed. Okay.
Yes. But
and ask questions if you don't understand. Ask questions.
Yeah. Yeah, I feel like sometimes doctors give you things and recommend things and not necessarily explain to you. And it's okay to say you don't know. Just ask them what is preeclampsia. Why are you asking me to take aspirin? We have so many patients that don't know why they're taking medication they're taking, and I think they can,
and that's not good.
Yeah, that's not good because then you don't stick to the routine.
Yeah.
Anything else?
I think that's it.
All right, comment below.
All right, guys. Thank you. Oh, wait, you have to do it on again. All right, guys. Thank you for watching. I really hope, once again, I hope you gained as much information and you enjoyed spending time with us as much as I did. If you have any, oh girl, ignore this.
What?
If you have any,
you have to show your face.
I do. Oh damn. All right, guys. Thank you. I really hope you enjoyed spending time with us as much as we did. If you have any questions, like I said before, please keep them down below in the comment section, and I'll be sure to get back to you. I'll be sure to get back to you or ask you one of my chiefs. Hope answering that answering. I'm not able to answer the questions that you have. And yes. Anyways, please don't you say it.
Yes,
He was saying, say it.
Don't you forget
Say it.
to like, comment, and subscribe on the link right here.
And share.
You better put that link
And
right
share.
here. And
Oh
share.
no, literally here.
Yeah.
And share. Oh,
And
follow me on Instagram, guys. Do you to follow your girl? Wow. Follow me on Instagram, guys. I'll put my Instagram page like
no, here.
here. Alright, I think that's it. Alright, until next time. Bye guys.
Take care of yourselves.
Peace. It's done. The company will be in person.
You can send your video.
I'll do it.
Your audition video.
Alright, y'all ready? Alright.
That was new.
Oh yeah? Okay, nice.
You want to do it?